In a world where screen time is often villainized as a health hazard, an unlikely hero is emerging in the medical field: video games. Once dismissed as mere entertainment or even a harmful distraction, gaming is now being recognized for its potential therapeutic benefits. Welcome to the era of prescription video games, where your doctor might just send you home with a controller instead of a pill. The rise of digital therapeutics. The concept of using games for health isn't entirely new. For years, therapists have used simple games to help patients recover from physical injuries or cognitive impairments. But recent advancements in gaming technology, coupled with a growing body of research, are elevating video games from casual therapy tools to FDA-approved medical treatments. In 2020, the U.S. Food and Drug Administration made history by approving the first prescription video game. EndeavorRx, designed to improve attention function in children with ADHD, marked a watershed moment in the field of digital therapeutics. This groundbreaking decision opened the floodgates for a new wave of game-based treatments targeting a variety of conditions. Beyond ADHD, the expanding landscape of therapeutic gaming. While ADHD treatment grabbed headlines, the potential applications of prescription gaming extend far beyond attention disorders. Researchers and developers are exploring game-based therapies for an impressive array of health issues. Pain management. Virtual reality games are being used to distract patients from chronic pain or to aid in physical therapy. Mental health. Games designed to combat depression and anxiety are showing promising results in clinical trials. Cognitive decline. Puzzle games and brain training apps are being developed to slow cognitive decline in older adults. Stroke recovery. Games that incorporate motion controls are helping stroke patients regain motor function. Amblyopia, lazy eye. Specially designed games are being used to treat this common visual impairment in children. Physical rehabilitation. Games that use motion tracking technology are making physical therapy more engaging and effective. The science behind the play. But how exactly do these games work as therapy? The answer lies in the unique properties of video games that make them particularly well-suited for therapeutic applications. Engagement. Games are inherently engaging, encouraging patients to stick with their treatment regimens. Adaptive difficulty. Games can automatically adjust their difficulty to match the player's skill level, providing an optimal challenge. Immediate feedback. Players receive instant feedback on their performance, reinforcing positive behaviors and correcting errors in real time. Measurable outcomes. Games can collect detailed data on player performance, allowing for precise tracking of progress. Neuroplasticity. The intense focus and repetition involved in gaming can stimulate neuroplasticity, helping to rewire the brain. Safe environment. Games provide a safe space to practice skills or confront fears without real-world consequences. Overcoming skepticism. Despite the growing evidence supporting therapeutic gaming, the field still faces significant skepticism. Critics argue that games could be addictive or that they might replace human interaction in therapy. There are also concerns about data privacy and the potential for overdiagnosis if games become the primary diagnostic tool. Proponents counter that these concerns, while valid, can be addressed through careful game design and implementation. They argue that prescription games are not meant to replace traditional therapies entirely, but to complement them, providing engaging, accessible, and measurable treatment options. The future of play as medicine. As research in this field progresses, we're likely to see an explosion of new therapeutic games targeting a wide range of health conditions. But the impact of prescription gaming could extend far beyond treating specific disorders. Imagine a future where your annual checkup includes a gaming session, with the game providing your doctor with detailed insights into your cognitive function, reaction times, and even early signs of neurological issues. Or consider the potential for preventative gaming, specially designed games that keep our brains sharp and our bodies active as we age. The integration of gaming into healthcare also opens up exciting possibilities for telemedicine. Patients in remote areas could access specialized treatments through prescribed games, with their progress monitored remotely by healthcare professionals. Balancing act, entertainment versus treatment. As gaming becomes more deeply integrated into healthcare, an interesting dynamic emerges. How do we balance the therapeutic aspects of these games with the need for them to be genuinely enjoyable? After all, the most effective therapeutic game is one that patients actually want to play. This challenge is pushing game developers to new heights of creativity. The goal is to create games that are so engaging that patients forget they're undergoing treatment all while delivering measurable health benefits. Regulatory hurdles and ethical considerations. The rise of prescription video games also presents new challenges for regulators. How do we ensure the safety and efficacy of these digital treatments? What standards should be applied to game-based therapies? There are also important ethical considerations. As games become more sophisticated at collecting and analyzing player data, how do we protect patient privacy? And in a world where health-related games are freely available, how do we prevent people from self-diagnosing or self-treating based on their gaming performance? A new paradigm in healthcare. The emergence of prescription video games represents more than just a novel treatment approach. It signals a fundamental shift in how we think about healthcare and therapy. By harnessing the engaging, adaptive, and data-rich nature of video games, we're opening up new avenues for personalized, accessible, and effective treatments. This paradigm shift extends beyond the doctor's office. As the line between entertainment and therapy blurs, we may see a future where many of our leisure activities are subtly optimized for health benefits. The games we play for fun might also be keeping us mentally sharp, emotionally balanced, and physically active. From pixels to prescriptions, as we stand on the brink of this gaming revolution in healthcare, it's clear that we're witnessing the birth of a new medical field. The journey from pixels to prescriptions is just beginning, and the full potential of therapeutic gaming is yet to be realized. While challenges remain, the promise of prescription video games is undeniable. They offer a unique combination of engagement, precision, and accessibility that could transform the treatment landscape for a wide range of conditions. So the next time you pick up a controller, remember, you might be doing more than just playing a game. You might be taking a dose of the future of medicine.